Pressing record here.
Okay.
Hi there. I'm here today with Angela Fishman, who is an expert physical therapist who focuses on the pelvic floor. And Angela, I'm just going to ask you to introduce yourself and tell everyone a little about what you do.
Sure. So, like you said, my name's Angela Fishman. I'm in private practice. The name of my business is called My Pelvic Therapy, and I focus on providing pelvic health therapy via telehealth to help increase the convenience to people, to increase really the consistency of being able to attend therapy. Because I've been treating pelvic health issues for about 20 years, and a couple stumbling blocks are that people had to travel quite far to see a pelvic health therapist because there's not a lot of us. People might be in a busy time of their life. They might have just had children and it's hard for them to get babysitters. So they might come for one or two appointments and not be able to keep the rest. So I really wanted to try the telehealth model to be able to see, could we get pelvic health therapy directly to somebody in a little bit more of a convenient and consistent manner.
Yeah.
So yeah, so that's kind of how I started my business.
And did you move to telehealth during COVID or did you do that before COVID?
I actually planned it before COVID. So
Yeah.
I planned it the fall of 2019 and
Brilliant.
just kind of happened. Yes, it was serendipity, I guess. It just my last day of my job, my in-person job was about March 5th. And so yeah, it just kind of fell into the pandemic. So I was lucky in that respect because people got quite comfortable being online and being able to communicate well online. And it gave me a lot of time too to be able to build my skills because the skill set online is definitely different than in person.
Yeah.
So it worked out actually quite well.
So I noticed that too, during the pandemic, I moved to doing a lot more telemedicine. And I only see patients via telemedicine or in person in Oregon and Washington, because that's where my license is. But it is different, right? When you're not, I mean, you're seeing someone in a different way. You're seeing a different part of their body. You're not seeing their whole body. You're not always seeing how they move and they walk. I feel like I learn a lot watching someone walk into the office.
Yes.
And then you can't touch them, right? And that too is learning to assess someone in a different way. So is that hard for you to not be able to directly assess someone's muscles during this?
So I thought it would be much harder, honestly, than what it was, because I always tell people they're fully dressed when I'm with them, so that gives them some comfort. And I also tell them they need room to stand, sit, and lie down during our session because I
Okay.
need to be able to see them walk. I need to be able to see them stand and bend and move. I need to be able to test them. What is their strength doing? I need to test them in different positions as well. So they kind of move back, they change their camera settings so that I can see them in all those positions. And the positive side of it, so yes, you can't touch the muscles, you can't obviously do manual therapy, but you look at the person in a very holistic way. So now you're seeing their whole body move. And while my focus is the pelvis, everything attaches to the pelvis.
Yeah.
So what's the strength of the hip muscles? Are they too tight and tense or are they too weak? Is there not enough motion at the hips? I can see all of that. Same kind of things for the lumbar spine. I can see all of that as I'm having them move. So it was definitely a different skill set to emphasize, but I was pleasantly surprised with how much you could do. And I feel like it helped me look a lot more holistically versus boom, just going right to the pelvis when someone walks through the door.
Yeah, it's interesting, isn't it? How you can change your approach, but yet feel like you're achieving similar results, right?
Yes.
I mean, I feel like yeah, over the last couple of years, I've just learned so much,
Mhm.
talking to people virtually and just doing things a little bit differently. So, as you know, one of the things we talk about all the time is how so many women have a hard time contracting their pelvic floor, right? That it's not
Correct.
something that we're necessarily in tune with. It's hard to assess that, that you're doing it correctly. How do you make sure they're contracting those muscles correctly?
That's a great question because I can't check. I can't check manually, right? Which
Yeah,
some of my patients are glad I can't because that's one of the barriers of them coming in for therapy.
correct.
So I lean into that fact. But I've been doing this for about 20 years and I know what I'm supposed to be hearing. So over time, I know what should happen. So if the first day I explain to them how to do a Kegel in quite a lot of detail, make sure as I watch them do it, I really can't see anything because if I start seeing them cheat, I can see that through the video. And then I see them in a week, and all the things that I ask them to do, I should be seeing a certain amount of improvement by then. So I check in with them right away. And if I'm not seeing what I'm supposed to, then we go back and go, oh, well, maybe they weren't doing that Kegel right. And we can go back and revisit that. But that's usually not what happens. Once you have somebody who's comfortable, they're in their own home, they're comfortable talking about this, it's private, they're not in a busy clinic, right? They can really focus. I have yet to have to go back and re-instruct people in it. So they really do seem to kind of get the hang of it a little bit better when they're really focused. Because like you and I talking now, we're very focused on each other versus being in a big clinic where you're a little bit embarrassed and everything is a little bit
Yeah.
uncomfortable in that situation. So, but yeah, if they ever did have an issue where I'm not hearing what I want to be hearing over time, then I know something's up and I would recheck.
Okay. Yeah. So you've never had to say, oh, I think you need to have an in-person visit during the whole
Well,
time
I
you've been
have,
treating?
so I do free assessments with almost everybody, free consultations, because I do want to make sure that telehealth is an okay match.
Okay.
So I have definitely, because I'm held to the same standard as a therapist in person. So if I can't provide the same amount of care, the same quality of care as someone could in person, then ethically I can't see you. So I try and do a free assessment first if someone will sign up for that, versus just having them start, because I want to make sure we are a good match. And there have been people where I'm like, oh, you know what? This is a pretty complex pain pattern. I think you're going to need some actual hands-on
Yeah.
therapy. Let me match you with a therapist that lives near you.
Okay.
So I have had to do that, definitely. But I haven't had to, once I've started somebody, I haven't had to flip and have them see somebody in person.
And that free assessment is in person or that's a
Nope,
virtual?
it's through video, yeah, because I wanna
Okay.
make sure that before someone starts with me, they're comfortable with the medium, they're comfortable with me. I make sure that they're a good candidate for what I'm doing. So, yeah, I
Yeah.
think that free assessment is actually pretty important.
And yeah, I think that makes a lot of sense to me. And I think the points that you raise about doing therapy at home are things that I have seen as well, right? I mean, these issues are so tender, so personal. Women feel so vulnerable that I think everyone is a lot more comfortable in their own home, right? And it, you know,
Mhm.
you have your clothes on. There are so many things that make it easier. And you know, one of the complaints that I've heard about physical therapy in the past, I mean, it's actually everything that you've just said, right? Getting there is a big barrier, but then also feeling comfortable in the environment, right? Because sometimes the walls feel too thin. You're worried about
Yeah,
somebody walking in. There's, you know, six people around you of the opposite sex who are there for knee issues. And, you know, it
exactly.
just is not perhaps as private of an environment, or let's just say as optimal of an environment as one might pick, right? And so you've eliminated all of those things, which is brilliant.
Yes, that's my hope, definitely. It's such an intimate part of our body, and it's hard. Sometimes we're the first people to even ask them about what's going on here because they hide it from their spouses or partners, they hide it from their parents, they hide it from their friends. And so once you kind of open that door, it's this very important trust relationship that starts coming and all the stuff starts coming out, right? And they're really starting to let go. And that's really where a lot of the emotional healing can happen too, because
Yeah.
this area is not just about, it's not just about Kegels. It's not just about the pelvic floor. It's truly, and I would say the majority of my patients, there's some emotional connection to what's going on also. And that healing, I think, is much easier to do when you know you're in your own home, you're dressed, you're not near other people, you can make sure you're private at home as well, and it's a little bit easier to open up.
Yeah, I think you're right. I mean, the connection to, you know, some emotional pain and emotional healing that needs to be done is really strong. You know, the data on how much women hide this from their close friends and their spouse is really amazing. I always tell my patients that, you know, I deal in TMI, right? Everything I do
Yeah,
is something that you
I love
wouldn't
that.
talk about with anybody else, right? So I kind of consider myself to be the TMI physician in a lot of
I love
ways.
that. That is
Um,
so true.
but you're right. It's not just a muscular issue, right? There are so many other things connected, and I think, you know, the thing that's really important to recognize is just the sense of shame that a lot of women have that are, you know, kind of centered around bladder leaking. So before I forget, I just want to say one thing, and that is everything that we're talking about will be in the show notes. So if you're listening, I just want you to know that you can look there and you don't have to write anything down. I'll make sure to include all the important references in the show notes. So one of the things that we were talking about before we got started was why women aren't more proactive in looking for help in this area. And I don't, what are your thoughts on that?
Well, when I honestly thought it would be an easier transition for me to get people to do therapy with me. And that's something I've had to learn. I've had to change my approach since I started my business 3 years ago, because there's a lot of information out on the internet. And I made the assumption that people know more these days about why they might have issues. But really, people don't even know to look to see that this is an abnormal thing. So many women just assume, well, I've had 2 kids. Everybody leaks a little when they cough or sneeze. Or, well, my mom always leaked, so I know I'm going to have bladder problems. Or I was born with a small bladder. That's just the way life is. And I truly did not fully appreciate that until I started really reaching out. I would talk with people who were telling me that they had bladder issues, and they just were willing to kind of be strong and put up with it and live life, which is great to one extent. But from the other extent, if you talk to them deeply, they're constantly thinking about their bladder. They
Yeah.
always are trying to figure out, well, where's the bathroom at? They don't want to travel too far because they're worried about going to the bathroom. And I think it impacts their lives more than they even know, because once you do start to treat somebody, they're like, wow, I didn't even realize that I was doing this pattern. I had it for so long. So there's a lot of barriers to getting the help out there aside from the stigma. So you have something that has a lot of stigma, and you have a lot of myths out there that perpetuate that it's just kind of normal and I have to suck it up and deal with it.
Mhm.
So yeah, so I'm so happy to meet someone like you that also is like passionate about trying to get almost half of women have leakage, adult women, right?
Oh,
So
yeah. I mean, the
that's a
number
lot
is
of people.
huge, and I agree with everything that you're saying, right? I think that you change your behaviors. I think that you stop doing the fun things, right? You slowly
Right.
stop exercising. You're careful about your social engagements. And there's lots of ways that you kind of tweak your life that aren't necessarily healthy or leading to a fulfilling life, right? Because you're getting
Right.
rid of a lot of the fun stuff, right? Because
Well,
you're
even
not
something
playing
as simple as like
tennis,
wearing right, excuse me. Yeah, even something as simple as like wearing white pants.
right?
People stop doing that, right? And you don't even realize that that's something you've given up. So I've had people after the fact, when they've gotten better, come back and tell me a lot of different things that they're like, I didn't even realize I was
Yeah.
doing that. So
That's so funny that you say that, because initially when I was thinking of podcast names, I was gonna name my podcast In Search of Wearing White Yoga Pants, right? Because
ah,
I
I
feel like
love
I hear that
that.
all the time, right? I have to
Yes,
wear, black pants to exercise. I wrap something around my waist. I'm so worried
right,
that I'm gonna be leaking during the exercise. I'm so worried that I smell, right? Kind of all
right.
of those
Right. Those are
things.
such horrifying things to have to live with every single day.
Yeah.
Yes.
And yoga's hard enough, right?
Yeah,
Without
exactly.
needing to worry
Especially if you
about
make it
all of
hot
those
yoga.
distractions. It's hard to be in the moment. And I think the other thing is that so many providers aren't comfortable with treating this and don't realize that there are things that you can do. And so I think what happens is a lot of times women will bring it up in very, kind of casual ways. Oh, I'm having a little bit of leaking, at the end of an appointment, and then it gets poo-pooed or it's not emphasized or taken seriously, right? Because things that are embarrassing, we don't necessarily say strongly. And so that reinforces the tendency to not do anything about it. So, and we're also entering this really weird stage where there's an awful lot of marketing about incontinence, and so you can buy a lot of things, and some of those things look really cool, and it looks like it'll fix it immediately, but that's
Right.
never quite the case, right? It's always a little bit more involved than
Right.
that. And so I think if you buy something, try it for 2 weeks, it doesn't work because you haven't used it long enough, or you're not getting the right reinforcement, or maybe not using it quite correctly. That reinforces the, hey, there's nothing you can do about
Nothing can
this.
do. And I think a big barrier too is that in our culture, for some reason, Kegels have taken hold, and everybody thinks pelvic floor issue, do a Kegel. And so everyone tries them, right? And then they're like, well, they didn't work for me.
Yeah.
And when I talk with them, okay, tell me, what does that mean to you to do a Kegel? How did you do that? How long did you hold it? How many did you do? How many weeks did you do it? Well, almost across the board universally, it's never enough what I call dosage. I mean, if you're going to strengthen something, you need the right dosage. And so they've already decided, well, I tried Kegels. That's the only thing that can help. And it didn't help. And I don't necessarily want surgery or medicine. So I'm just not going to do anything. I'll just live with it.
Yeah.
And so I think that's a big barrier. And while Kegels have their place, it's a shame that it got so equated. This one exercise got so equated with the pelvic floor, because a lot of times that's the wrong exercise anyway to do for
Yeah.
somebody.
Yeah. And I think, when people do it on their own, I don't think they're doing it. I agree. I mean, nobody does it for long enough, right? Because
Right.
it takes a while to see the results.
Right.
And I think, that's not, we don't keep doing things unless you see obvious progress, and you have to build in your markers that show you that you're making progress. And that can be really difficult to do on your own, right? Which is where you
Correct.
need a little bit of expert guidance. So
Right.
one of the other questions that I had for you was about pelvic floor relaxation, right? Because we see a certain number of patients who have really tight pelvic floors. That's leading to their issues, maybe some leakage, maybe pain, maybe a feeling of having a urinary tract infection, but cultures are negative. That's something that I think is really hard to diagnose on your own. I think you almost always need kind of an expert to say, yeah, this is what you need. But not all of those patients want to see a physical therapist. And so what kinds of things
Right.
do you recommend for those patients?
Well, so first of all, I usually try and explain that there's really three things you have to think about when you're trying to relax your pelvic floor. It's much harder to work on relaxing a tense pelvic floor than it is to strengthen a weak pelvic floor, because there's a lot that goes into that. Like you mentioned, a lot of times there's pain. There might have been trauma. There's all sorts of things that lead into this high tense pelvic floor. And you have to change some of that. So you can't just do one stretch, or you can't just do, one exercise. You have to kind of go through a process. So I explained it in three parts. The first part, what you and I would call motor learning, would be you need to learn, what does a tense pelvic floor feel like versus a relaxed pelvic floor. So I usually teach people diaphragmatic breathing or belly breathing, because as you breathe in, that helps the pelvic floor start to relax and come back in. So you start to get a little more in tune with the actual muscles themselves. When are they tense and when are they relaxed? There's another one I call Buddha belly. I have them get on all fours or lean over a counter if they can't do that position, and really drop their abdominals, which is much harder than you think, because most of us hold tension there all day long because we want to be thin. But that extra tension really overflows strongly into the pelvic floor. So things like that. There's a few others that I do that those kind of things help a person get in touch with, okay, am I tense here right now on my pelvic floor, or am I relaxed? So you really have to do that motor learning part. The
I agree
second
with you.
part,
I think that's really a hard thing to learn, right? Because
it
those
is.
muscles are always working. A lot of
Yeah.
women just hold their tension there. And
Yeah.
once they get tense, it usually happens slowly over time, right? It doesn't happen overnight. And
Correct.
it's part of the way you use your body. So unlearning those basic kind of habits and reflexes is really hard. And letting your belly just relax, nobody can do that. I mean, that is
It's
a hard
hard.
thing to
I'll
do.
always tell them, okay, relax. And they drop down a little. They're on all fours. They drop down a little. Okay, now relax another inch. And they're like, I can't. Yeah, you can. Keep going. Boom. Then it finally goes. And they're like, oh, so yes, I can do that. And then you start to feel, okay, what is it when that's really relaxed? So yeah, that's such an important piece of it. The second thing is a lot of stretching. So stretching is hard. If you have tight hamstrings, tight groin muscles, tight rotators in your gluteal muscles, it takes some time and patience to stretch. So there's a lot of different stretches that I teach. That's kind of the second component. So we have kind of like learning, how does it feel like when you're relaxed? Then we've got a lot of stretching, because pretty much any muscle that connects into the pelvis can actually contribute to that elevated tone of your pelvic floor. So if I look at somebody that comes in with a tense pelvic floor, their hamstrings are tight, their groin muscles are tight, their hips are usually quite limited, and sometimes even their low back is very limited. And all of that tension kind of overflows and makes worse the tension in the pelvic floor. So you're really dealing with all of that. And in that category, I also think of scars. If I have a C-section scar that's not moving, I need to get that moving. Or a scar from having a vaginal birth, I need to get that moving. So mobility is kind of that big second one. And then the third category is what you were alluding to. Now you got to change the behaviors that keep perpetuating this, because a lot of times people will say, well, I can do that and I feel better, but it never stays. It always comes back. And that's that third piece you really need, is you have to change some of the behaviors that kept perpetuating it in the first place. If I'm somebody who clenches my jaws all the time, that's where I hold my stress. Well, then you try and get yourself to learn a different pattern, right? The same thing happens at the pelvic floor. Some people clench their pelvic floor muscles, or especially clench their buttocks together when they're stressed. And that all kind of rebuilds that pelvic floor tension again. So, don't be constipated, don't sit with poor posture, all those things you have to address. Otherwise, that tension just keeps coming back. So
Yeah,
it's
it's interesting that you
complicated.
brought that up. During the pandemic, when everyone moved to working at home, I saw an awful lot of women who were developing pelvic floor issues, all related to tension, all related to poor ergonomics of their working station at home.
Yes.
Right.
Yes.
And it would never get better until you kind of set up a better workstation, because you didn't, I mean, at the beginning, we all thought it was going to be pretty quick, and you didn't
Right.
realize, sitting at your kitchen table with your laptop on a, bad stool was not optimal at all. I see that a
Mhm.
lot in new moms too, right? Because you tend to
Yes.
do everything with one side of your body. And, I'm incredibly right-handed. I always held my kids on my right side, and it just led to, incredible imbalances. So, dialing back all of those things and thinking about all of the things that you're doing without thinking about it is a challenge for a lot of women, but is where, the answer is.
Right, exactly. So that's why it is kind of helpful if you have someone to guide you through this journey, because
Yeah.
everyone's bodies are different too. Like if I look at you, you might have tight hips, but if you look at me, I might have a tight back. So where's my focus going to be? Because I can't
Yeah.
do all of these things. Life's too busy, right? So it does help to have a guide to just kind of focus. Okay, these four things are really what I think are driving it for you. Here's what I want you to focus on.
Yeah. And I think thinking of the other things that might have initiated it, right? So maybe a
Yes.
different injury that you've had that led you to use your body differently, that now is resulting in a pelvic floor issue. And, a lot of times you see those things and they're, it's not obvious, and it's not obvious to the patient, right? So a couple of years ago, I saw a woman who had been a softball pitcher, and had been a Division I softball pitcher, incredible athlete, but had major shoulder issues, right? Which then led to some back issues, and then started having all of these pelvic floor issues. And it all kind of started in her shoulder. And
Yep.
who would think of that? I mean, I'm sure you would think of that, but she definitely had never thought of that, right? And
Yeah.
starting with all of those things, and there had been several people who had recommended surgery for her, right? But the answer was really, figuring out her body and, healing the shoulder issue for her.
Right. It's all kind of about balance,
Hmm.
rebalancing everything that's feeding into, for our purposes of talking, into the pelvis, right? And it
Yep.
can start anywhere. It can start at the neck. I get a lot of new moms breastfeeding. So the postural stuff goes forward like this,
Yeah.
and then that leads this cascade. Well, now all of a sudden they're having trouble down in the pelvis. There's all sorts of things that can kind of start to get your body out of whack, and some other part of your body has to make up for that. So those strain patterns eventually change what's running through, and especially for us, down to the pelvis. So you're exactly right. Kind of addressing all of that is what
Yeah.
can resolve the pelvic part, even though it doesn't even make sense how far away that is.
Well, and I think it's so empowering for women, right? Because once you realize you're someone who maybe carries their tension in their pelvis, or you have a tendency to hold your body in a certain way, even when you learn to undo that, you're probably going to have some issues in the future, right? And so then having the skills to recognize it and, pull out your stretches, remind yourself to breathe,
Yeah.
maybe even plugging back into physical therapy, because a lot of these are chronic issues, and you need tools in your toolkit to be able to address it as you go forward. And I think that's really empowering, especially if you have had the issues for a while, and it took you a while to find the right person to help you unlearn your behaviors.
Right. And then we always try and emphasize that, like, keep your exercise sheets. Here's what I want you to do. A really common thing, let's say I see somebody who leaked when they coughed or sneezed, and we get them all better. And they're like, okay, now what? I'm done with therapy. How do I continue? So we kind of give them a little bit of a maintenance schedule, but then I tell them, you don't have to do this. No woman is going to do 1,000 Kegels a day for the rest of their life. So that's what they come to me thinking they're going to have to do. I'm like, no, that is not what you need to do. But the next time so you're not leaking now, you're done with therapy. The next time you have a cold and you're coughing a lot, remember to come back to your exercises, because coughing a lot is such a repetitive stress to your pelvic floor. There's a fair chance that something might come back, but don't freak out. Now you know what to do, because now you've got all the tools that you need to jump right back into what you're doing, and you can get rid of it again. And if you need help, come on back. But most people don't need to, because once they learn the tools, they're lifelong skills. And I hope what I'm trying to do is empower women so they do have a little bit of agency over what's happening to their body.
Yeah, I mean, I agree with that. The pelvic floor is definitely a mystery to a lot of women, and we don't realize how we use it. We don't realize when we use it. We don't realize that these muscles are always working, right? They're
Right.
always doing something. You can't rest it the way you could your arm. You can't put it in a sling.
Exactly.
And so, there's just so much education that needs to be done there. There's such an important part of the body that we ignore.
Right. Right. Absolutely.
So, can you tell me what you offer online?
Sure. So I'm licensed in 4 states. I'm physically in Illinois. So I'm licensed in Illinois, Colorado, California, and Florida. So you need to be in a state where a physical therapist is licensed in order to be able to receive physical therapy. So those are the 4 states that I'm located in. And pretty much I can provide any service that you could see with an in-person physical therapist. I can do it via telehealth. Aside from what I said kind of at the beginning, if I'm interviewing you and talking with you and I think you'd be better served in person, then I will let you know that. And those people tend to be complex pain situations, maybe post-surgery where they need some more really manual care.
Yep.
Something that I need to put my hands on, I'm going to tell you, you need to go down the street and see her, because she's going to be able to do that for you. So, but pretty much anything else I can do online. I focus a lot in the pregnancy and postpartum age group, because there's so many pelvic health needs through there. And then I treat bladder issues of any age. I've got people in their late 20s all the way to their 80s that I've seen. So those are kind of the two biggest things I focus on, just because the numbers are so much bigger. But really any issue, a hip issue, a back issue, a lot of times there's pelvic floor stuff going on with that too. So I see that as well.
And do you have any courses online that you offer to women that aren't in those states?
I do. I do. So I used to do them. So I developed them last year. They were really effective. I was quite excited about we did them live. So we had a live component once a week, live Zoom for 6 weeks. The first one was for stress incontinence, and it kind of became the support group. And I just loved it. As a therapist, I loved women talking about it. You could see people were like deer in the headlights the first night. And by the sixth, everyone was like great friends talking about all sorts of personal stuff. It really turned into this kind of support group. However, it was hard to recruit a lot of people for it. So I am in the midst of turning those into a course that you can just do on your own. And I'm trying to figure out that component of how do I provide for that support in a way that's meaningful for people. So they're not ready yet, but they will be soon. So I'm taking them from this live version and turning them into an online course. So I have one for stress incontinence and one for overactive bladder. And then some women have components of both of that. So would actually benefit from both.
And if someone was interested in that, even though it's not quite ready, where might they
Yeah.
find it?
Yeah, so you can go to my website is mypelvictherapy.com/courses, and you can put yourself on a waiting list. You can pre-enroll and put your name in, and you'll be notified as soon as the course is ready to go.
And then you also have some information for relaxation as well, correct?
I do. So, because relaxation and getting a tense pelvic floor relaxed is a little more complicated than the strengthening piece, I'm put together a guide. So, it's a free guide. It's if someone is interested in kind of a lot of what we've been talking about today of knowing more how to relax your pelvic floor, you can go to mypelvictherapy.com/relax and you can download it there.
That sounds great. I just want to thank you for your time and your expertise. I really appreciate your passion in this area, and I think you're helping so many women and, breaking down some of the barriers. Going in to see a physical therapist is really hard. One of the things that I've found in my practice is that at least meeting people initially online is just so much easier for a lot of women, and just, makes everything a little bit easier. And that's the goal, makes it more obtainable.
Yes, no, I totally agree. And I similarly am so excited to meet someone like you who also has a passion for bladder because the word bladder is not a sexy one, but there's just so much suffering that's related to it. And so, yeah, I'm super excited to be able to talk to you today because it's so important to get this information out to women so that they're not suffering from these issues.
I agree. We have our work cut out for us.
We do. Well, it's good we got the two of us. We got it. We keep recruiting people, right?
That sounds great.